Why does the treatment of ADHD not always work when it's meant to be such an effective medication? You know, the media often portray ADHD in a very controversial way, and there's a lot of criticism. So often parents and the public, when they are faced with a diagnosis of ADHD, they come from a point of skepticism and they don't start off with a positive outlook on the problem. So, you know, it is in a way a problem of media perception that starts off with a self-fulfilling prophecy to fail. Despite the fact that it's been around since 1902 and was first found to be responsive and effective in 1936, it has been treated by professionals since then. So why do many professionals and doctors struggle to find effective relief for their patients? And I'd like to discuss some of the reasons for this. You know, unfortunately, there is doctors who start off managing the problem, and I'm afraid sometimes it can start off from school or therapists that see children and families with ADHD and often try and water it down, kind of perceive it as a start off light, start off natural, start off in a very sort of insignificant way. If your child is diagnosed with ADHD, it means that they are in a serious category. It's not that they're in a mild category. If they were in a mild category, they wouldn't have ADHD. So part of the problem is that the treatment often doesn't start off with medication. If it is treated early, take for example, if your child was short-sighted and needed glasses to see the board, you wouldn't try some kind of vitamin supplementation or have a test for a whole year with your child sitting in front of the teacher, in front of the board. So, you know, this is unfortunately a bit of a problem, is that if medication is effectively used, you can get your child to the point where often everybody sees a major kind of breakthrough. There is a lot of traction, and all the other therapies that can be used often get kind of traction and become more effective. And remember, ADHD is a neurological condition. It's a neurochemical condition. It's a genetic condition. It doesn't just disappear overnight. And your child needs the best treatment really up front. But unfortunately, what I find in my practice is it is difficult for parents to accept that this is the problem. Often when you can't see something, there's no scan, there's no blood test. And I do get it, you know. It's very difficult to accept, particularly if you don't see the problem at home and the teacher sees it at school. There definitely can be a difficulty accepting what needs to be done. So, you know, you can't expect your child to just squint at the board for a year. They need real help. And that's often the reason that the momentum behind the diagnosis is lost. If we treat it properly from the first get-go, often children can come off that medication and often other treatments can be a lot more effective. But, you know, when your child has lost self-esteem and there is poor kind of traction in the class, the child falls behind further with academics, emotional control, loses friends, doesn't make friends, this is a problem. Unfortunately, it's perpetuated by some therapists that, you know, try, eye exercises, you know. Fair enough, diet, exercise, sleep, hygiene, organization, structure, tutoring, all those things work. But my goodness, the efficiency is so much greater with medication. And then, number two, often, unfortunately, in my position, I see children come to me where the doctor doesn't understand the problem. And you know, when you have a set of parents that approach a doctor and ask them questions, you know, why does my child remain hyperactive? Why does my child remain still impulsive? And they don't often have the answers. And it shouldn't be for parents and the patient asking the doctor. The doctor should tell you. They need to help you understand that this is a medical problem. Children actually can't help those problems. It's a self-control disorder. So if the understanding is correct, and in my opinion, the number one treatment for ADHD is understanding. If you understand the problem, you will understand what to do. If you haven't been given that insight and that understanding, you won't know how important the medication is. So you need to find a doctor who understands this inside out. And one of the things that I often find is, children have been through years of they've just been sometimes dished out medication. Often doctors just re-prescribe it. They don't add anything. They don't adjust. And children get older, they get bigger, they outgrow their doses, the situation changes. Sometimes things become a lot worse. They need extra help. And the doctor doesn't have the insight. So you need to get somebody who really understands. And then there's this whole concept of learnt helplessness. And this really is a psychological phenomena. And, when there's a self-fulfilling prophecy where, somebody is on medication and things don't get better and they just accept the fact that, well, they've got ADHD, so, that's the maximum or the greatest ceiling potential that we can expect from the child. And there's almost kind of an acceptance of failure. My child's got ADHD, they're not going to do well at school, they're not going to get a good grades, they're not going to get a good college qualification, they're going to have difficulty. It's almost like a self-defeating prophecy. And what I find often that is the case? It's the parents, unfortunately. Remember, this is a genetic condition. 77% of the inheritance is from the parents. And when a parent is not together, they're disorganized. And I'm afraid I see them in my practice. They're often late for their appointments. They often don't get the teacher to fill in the forms. They sort of leave things to the last moment. They don't complete the rating scales. They don't think ahead. Their lives are chaotic. Unfortunately, you need to get your you-know-what together in order to help your child. So half of the problem, I think, is when things do not progress well, it's a parent that needs help. And I often find that I'm, having to refer parents, help them, advise them to get help themselves, because that is the first step as well. If your child sees a parent who's not together, not organized, how can we give advice? Often parents give up because they find their own ADHD and organization and structure to be a real challenge. So sometimes it's an easier way just to let the treatment fizzle out. They often forget to give medication, often forget to give it to the teacher, often forget to give instructions, get feedback. So I do understand that that's a problem. So please remember, parents also need help and treatment. And, society removes the interventions when a patient improves. At school, sometimes I see a child that improves, who's been given accommodations, extra time, extra kind of accommodation, separate venues sometimes, spelling dispensations, writing, sometimes even given a scribe. But when things improve, there's this perception that things have gone away. Just because things are working, the medication works. I often sometimes find teachers say to the parents, I'd like to see your child off medication. I don't think they need it. No one told me from the previous year that your child was on medication. Well, mostly the teacher doesn't see the problem because the child's effectively treated and the symptoms are being maintained. And parents often say, my child keeps taking this medication, I'm sure they don't need it. And remember, you only see the effect if you stop medication several months later when your child starts to decompensate. So don't give up early with treatment. And remember, the treatment is something that needs to be consistent. If your child needs medication when they're at school, give it consistently. Don't give up. And, I think also there's this perception that children just outgrow it quickly. Sometimes we do trial children off medication, but remember that just because your child's improving doesn't mean to say they don't need the medication. And, unfortunately, that leads to the medication being stopped too early. Not being able to adjust the dose, the side effects. Parents see the side effects. Their child sometimes, if they forget to give medication, they give it inconsistently, then things don't go well. They phone the doctor and say, things not going well. The reports are poor. And unfortunately, instead of reviewing the child, sometimes the doctor just ups the medicine. Then you've got a zombie-like child, not sleeping, not eating. So you get into this vicious cycle. That's why I insist parents and getting feedback from the teacher, from the child, at least every 4 months, and not kind of throwing parents in the deep end, following the child up until they are consistently being managed well. So the other thing is, parents sometimes don't recognize, as I say, their own symptoms. And please remember that ADHD is something that can be treated at any age. So I hope this helps in understanding that ADHD can sometimes be something that doesn't seem to be working, but it needs consistent follow-up, needs parents to be treated, it needs understanding. This is not a quick sprint. It is the comrades marathon. It's not the 100-meter dash. So please let us know if there are problems. And it's communication, As I say to my parents, I'm not telepathic. I don't have special powers. I'm not Superman. Talk, communicate. Let us know how things are. I won't ignore those symptoms. I don't ignore messages from teachers. So let us know. These are things that can be really managed and helped. So I hope this helps.